as simple as that.
I mean, it's amazing. If you read the comments on the, I take Yang as an example because it just happened, but if you read the comments on the Sunday special that I did with Yang, there is nothing, like legitimately, I never read the comments, but I was curious, there is nothing but appreciation that Yang would even come on the show.
Yeah.
That's the entire thing. It's like, oh, look, a cordial conversation between people who disagree. That's so nice. Like, how pathetic is it that that is considered like the big win here? There wasn't a single comment about like, oh, Shapiro destroyed Yang there, because that wasn't the purpose of it. Everybody got what it was supposed to be. It's a conversation, and that's great.
Did he move you on anything, like a UBI situation?
Well, I mean, I'd read his book. Right, I'd read his book, and I didn't find it utterly convincing on a UBI. I think that, as I've said before, when it comes to UBI, if we reach the point of absolute crisis where nothing else, let's put it this way, UBI as negative income tax in lieu of all of the welfare systems we currently have, I would sign on to in a heartbeat. Right? The idea of we get rid of
real repeal and replace.
Right. If you repeal all the welfare programs and you replace it with a single check that is signed, then, but I think the promises of UBI are a little bit too big for its britches. So people are saying, well, it'll solve the opioid epidemic, or it'll solve the, as I say in the book, I think it's a crisis of meaning, not a crisis of money. And so I don't think that's going to solve it. If the idea is that people are going to be liberated, as Andrew says in his book, to go and do art and volunteering and charity, I don't see any evidence of that.
That's the part I don't.
Right. That's the part where I was like, no.
Even if you could get me on the robots are replacing all our regular job part.
Right.
So let's say you could get me on that. The other part is just that it takes away something about fundamental human nature, about what you're talking about before, about the individual going out there and getting theirs.
Right.
That you would just end up having this class of people that would be given just enough. I mean, you have a new welfare state.
Right, exactly. And what he said was, well, it's not enough to actually live on, it's just enough to actually supplement. And what I said is, so what's the limiting principle? Like, is it just the 1,000, or is a politician going to come around next week and say it ought to be 3,000, and then you have...
What did he say that? Because I haven't seen
He didn't really, I don't think he really firmly addressed it.
Because that's the key question, right? It's not, well, okay, we can get $1,000 and we're good. It's that literally the next week,
there will be somebody who says $1,001. He just prices right people out, right?
Yeah, then what are they going to say about the lefties who want 1,000? They'll call them racist, or...
that's exactly right. I mean, there are some problems in implementation of UBI that exist with the welfare state. Also, a lot of the studies that suggest that there's the same level of employment, those are temporary UBI attempts, right? If there were a permanent UBI, I think that you would see a decline in employment. But also, as I said to him, there's a conflict between what UBI says it's trying to do and what it actually would do. So I think it would do the same thing as the welfare state, and that's why I say, like, as a replacement for the welfare state, I'm kind of warm to it. But
you're just like, let's give it a shot, basically, right?
Right, exactly.
We have something that's failing, let's...
right, and also because I'd rather have the government sign an understandable check rather than you have to go through, you have to de-incentivize work or de-incentivize fatherhood, or all these incentive-based structures. I'm not a fan, and they've been rather ineffective. But as a general principle, the idea that it's going to solve the work crisis, what he talks about in his book is the crisis of people who don't have jobs, and that crisis is the not having of the job, not merely the not having of the money. So signing people a check in lieu of a job doesn't actually, like he points out in the book, the number of people on disability has been rising dramatically. Right, and they're all getting a check. And are they happy? Are they spending their time volunteering? Are they spending their time down at the local way station helping people? Or are they, taking drugs and hurting each other?
It's like, it all sounds good. Medicare for all, it sounds good. We will all have the same thing. Now, we know that that's not going to be the case because, of course, well, now they're talking about getting rid of private insurance altogether.
Which is insane. I mean, that's fully, but they have to do it because otherwise doctors just will not accept Medicare reimbursement rates. I mean, that's the reality. Again, as somebody who works closely with people in the medical industry, and in fact sleeps with a person in the medical industry, the idea that doctors are going to just accept 60% on the dollar of what they're making right now is absolute sheer nonsense.
But also, it's such a disconnect of what I think they view. I mean, I get it that they think government is something that I don't think it should be, but it's like, what right would the government have to tell a doctor he can't be in the private business that he wants to be in?
Right.
And they actually think that's okay. I mean, quite literally, Kamala and I think Cory Booker and a couple of others.
They think it's good.
No private insurance.
Well, I mean, this is another thing that I asked Yang about because he said he was for Medicare for all, and there's a section in his book where he says, so how are we going to deal with the fact that doctors are going to just stop going to medical school? Because that's a real thing that will happen. I mean, already, if you want to see how perverse incentives work in the medical industry, look how many people come out of medical school and go into what are called the road fields. It's radiology, ophthalmology, anesthesiology, and dermatology. Why? Those are the least regulated fields. There's the least Medicare there. Nobody's taking reimbursement rates. Those are all areas where people basically show up with an insurance company or cash in hand. That's where everybody's going. It's where all the money is. So that's how perverse incentives work. he says in the book, well, we're going to have to convince doctors that basically they need to rethink about what the lifestyle of a doctor is going to be, that they're not going to live high on the hog anymore, that they're going to, be putting out more for the public service. And I thought, well, you can do that, but it's not going to be the same people.
Does he say how to do that?
No, I mean, he sort of says that we should just, people will have to be informed that the incentive structure is different. And here's the thing, if you have a different incentive structure, you're going to get a different thing. Mm-hmm. My wife would not have gone to medical school if she were assured of, for 11 years, if she were assured of coming out making $65,000 or $100,000, right? The reality is that she wanted a certain lifestyle. It's why she went to medical school. You change those incentives. You think all these guys who are going in to be surgeons are going to spend years on end doing this so that they can then work for years on end working for Medicare? Does that sound awesome to anyone? Like, this is... The reason that smart people become doctors is because smart people would like to make money and be paid for their work. This is why yes, there is a self-sacrificial component to all of this. There are easier ways to make money than being a doctor. But to eliminate the money factor is to eliminate half the reason that people become doctors in the first place. You want a lot more people who are lawyers and McKinsey associates. This is the way to do it.
I have a good friend, 2 or 3 best friends from childhood since 2nd grade, who was like my chief sparring political partner our whole lives. And he's now become a huge Trump supporter. And why? Because he was a doctor, he went to medical school, raised all the debt, realized he could never live in New York where he grew up. He's now in Texas, and he's often doing things that have not to make money now because it's so hard. And then he became a Trump supporter because of Obamacare, because he was crushed with paperwork and bureaucracy and nonsense. And now to make money, because it's so much harder than just doing the procedures, he's basically doing like medical real estate things.
Yeah.
And it just shows you how the whole system, I mean, that's just one guy, but it's like the whole system is out of whack.
Doctors are going into concierge care specifically because of this.
Yeah.
I mean, there are full apps that exist where you're paying like $99 a month, and then a doctor will show up at your door. Like, there's so many ways that we could make medical care online should be such an asset for medical care, right? There's so many getting rid of licensing requirements, as I suggested, would be a great thing. Like, there are things that we can actively do to do this. And the truth is, for healthy people and for people who have private health care insurance, there really isn't a problem. Like, we like to talk about how it's too expensive. Why do you think we have millions and millions of jobs in the healthcare industry? Like, what do they think happens when they nationalize this thing? All those jobs just transfer over to government, or are a lot of those jobs lost because those people don't work for anybody anymore? Why is it that people ignore the upsides of?
Well, what do they think? Does anyone answer that question? What are you going to do with all those people at the private?
No, and they don't.
Are they going to all be hired by the government to do nothing?
Right, and nobody seems to understand that the reason that the majority of new drugs and procedures are discovered in the United States is because we are paying those outsized prices. So when Trump says that we are paying for everybody else, that is true. We are paying for everybody else, but if we stop paying for everybody else, they just will stop producing those drugs here, because why else would they produce the drugs here? Like, our system is not good, but to pretend that our system is like the worst system on planet Earth, or that people are dying, I mean, quick statistic that nobody likes to cite but is true, if you get rid of shooting, of homicides and car accident death, where people die like at the scene, from the American death rates, America has the #1 life expectancy in the industrialized world. Those are not medical issues. Those are issues of people shooting each other and people getting car wrecks a lot here in the United States. So, that's, and as far as us spending per capita, like insane amounts of money, we spend more than other countries. It is relatively in line with the OECD income. So for on a per capita income basis, we spend a lot of money. We also make a lot of money here in the United States. And the medical industry here is a huge part of the American economy. All of Pittsburgh is basically the medical industry now, as opposed to the steel industry, and that is a very good thing for Pittsburgh. So the answer to a lot of this is deregulation, not re-regulation. But again, those are conversations I think that can be had, but I think that people are not being realistic about what they expect from the system, and they're not realistic about the downsides of systems that are completely nationalized. I mean, in my opinion, if you're actually going to get the government deeply involved, we've got to have a Swiss system where basically people are paying a percentage of their salary into private insurance, and then they are expected to do that, right? Like, the individual mandate, if you're going to get the government involved, is not the world's worst idea. It's just that it's now stacked with enormous amounts of regulation and inefficiency and bureaucratic inefficiency, but I think, again, that a free market is better than any of that stuff. But I also think that you ought to take responsibility if you are if you don't buy insurance and then you get hit by a car. I'm sorry, that would be a you problem. Like, that's why we need a social fabric where I care about you.
Yeah.
But on a governmental level, this idea that you're not going to increase the rates of use with government care is just a lie.
Right,
People
but we are going to pay for those people no matter what, right? I mean,
right.
They're not,
Well,
they're not going to turn them around at the emergency room, so we are going to pay for those.
Right,
people.
but getting hit by the car is usually not the real issue. Usually the real issue is how do you pay for the person who didn't buy health insurance for years and then gets a heart condition that requires years-long care. Like the person who's in the ER is going to get paid for that. We all end up paying for it with elevated insurance rates and all the rest of it. But the problem of the chronically unhealthy, which is a very small percentage of the population, but the most expensive percentage, that is not really a rationale for overturning healthcare that 90% of people seem to enjoy. Like
it also is going to make you hate people for no reason. You're going to go to In-N-Out or McDonald's and see a table of 4 obese people stuffing their faces, drinking high fructose corn syrup and everything else, and you're going to go, wait a minute, these people are all
they're living off my dime, right? They're living off my dime.
I mean, this is a horrible. I mean, this goes to the community.
Funny.
No one wants to look at that and think that.
Well, this is why I've said people who try to compare, for example, the Nordic healthcare model to the U.S. healthcare model. You're not comparing equivalent populations. People eat healthy things in Norway. People in the United States eat nothing but crap all the time.